to my channel, Medicare Secrets, where we uncover the mysteries and the mayhem of Medicare. So today I want to go over an article from the Kaiser Family Foundation, which is again a very trusted source. Just released, we found out that more than 28 million people, Medicare beneficiaries in this year, 2022, that's almost half the Medicare population, have enrolled in Medicare Advantage. So there is a big difference between original Medicare with a Medicare supplement plan, also known as a Medigap plan, versus a Medicare Advantage plan. So the reason why so many Medicare beneficiaries are enrolling in these Medicare Advantage plans, a huge reason are the incentives, the extra benefits that are offered. We're going to dive in to what's going on with the Advantage plans a little bit. There's some investigation going on. What happens is when you go on Medicare Advantage, you come off of original Medicare, our Part A and Part B. You still pay for Part B, which this year is $170.10, but you are no longer on the federal government program. You will be managed by the insurance company, and it will have a network, which means you have to make sure your doctors and your hospitals are in network, which would be an HMO or a PPO on your card. And so if you ever see HMO or PPO, know that you are on a Medicare Advantage plan. But it does take you off of the original Medicare system, which, what does that mean to you? It means that things like prior authorizations are not going to come from our Medicare program, which is literally set in stone. I mean, it's voted on and it's our government Medicare. So once you're on Medicare Advantage, you're no longer on that government program, and all decisions, claims are left up to, when you're on Medicare Advantage, the insurance company. So what that means is prior authorizations. If you have to go in for whatever it may be, your Advantage plan is making all the rules. And they are the ones that are setting boundaries for you to get the next treatment. When you're on the original Medicare with a Medigap plan, when you have the original A and B, you can go anywhere you want in the whole entire country that takes your red, white, and blue Medicare card. Number one, there are no networks. And number two, you're getting what you're paying for. You're on the federal Medicare program. You're paying $170.10 a month. Don't you want to use it? But if you can't afford the Medigap, that's understandable. They usually range in cost $90 to $130 extra. In some markets, they can be a little bit higher, but they give you better coverage. We're going to go through the Kaiser Family Foundation article, and we're going to read what their data, what their analysts have discovered about why there has been an uptick in Medicare Advantage enrollees. And there are other articles that are out there about things like skilled nursing not being covered by Medicare Advantage plans. And things like that make me worry. We write in our office both types. We write original Medicare we write the Medigap plans that go along with your original Medicare, and we write the Medicare Advantage plan programs. But when I speak to a client, there's a lot of questions, and I like to find out if it's the right program for you. There's a lot that goes into that decision making. So just make sure you have a real good agent that you're working with. Okay, let's go right into this article right now. Advantage enrollment reaches more than 28 million in 2022, nearly half of the total Medicare population. Wow. All right, more than 28 million people are in Medicare Advantage MA plans in 2022, with the program accounting for nearly half of all Medicare beneficiaries, a new analysis finds. The analysis released Thursday by the Kaiser Family Foundation also showed how spending on MA, especially on quality bonuses, has surged to take up more than half of all federal Medicare spending. The findings underscore the widespread interest in the insurance industry on the Medicare Advantage MA marketplace, which has grown more lucrative in recent years. Well, gee, guys, 11,000 people a day are turning 65. There's a lot of profit in there by our government and Wall Street and everything else, but I'm going to keep going. This is what, and by the way, this is what I said. One of the things that appear to be driving enrollment is all the extra benefits: dental, vision, over the counter drug benefits, transportation, and meals that more and more plans are offering, said Meredith Freed, a senior policy analyst with KFF, in an interview with Fierce Healthcare. We don't know a whole lot about whether people are using them, how well they are working for people, and if they are lowering healthcare costs for plans that were using taxpayer money to provide these benefits. The foundation looked at data from the Centers for Medicare and Medicaid, which is called CMS, on enrollment and benefits in MA, Medicare Advantage. I want to go down to this. Plans with high star ratings multiply. In addition, Kaiser found that nearly all Medicare Advantage enrollees are in a plan that requires prior authorization for some services. The finding comes as a federal watchdog has raised questions about the level of prior authorization denials that may fit within Medicare's coverage requirements. There were a lot of denials in the last year. It brought huge attention to this federal watchdog group. Also from the Kaiser Family Foundation, the share of Medicare Advantage enrollees required to receive prior authorization by service for this year, 2022. Most enrollees in Medicare Advantage, by the way, are required to receive prior authorization for the highest cost services, and fewer enrollees need to receive it for preventative services. Wonder why? Because preventative services, insurance companies want healthy people on the plan. So they love to, they're fine with paying 100% or having zero copays for preventative services. It's the expensive services that are concerning, that the claims can be denied because they do require prior authorization. So we're going through, I'm going to go down each category of service that would require prior authorization, and the percentage of people this year on those plans that did require prior authorization. It's big, guys. So listen up. Some services, Medicare Advantage, some services, 99%. Very generic category there. Moving next, durable medical equipment. That means oxygen, wheelchairs, things that you would get at a medical supply store. 99% of Medicare Advantage enrollees this year were required to receive prior authorization. Part B drugs. So that would mean in a doctor's office, an infusion or an injection. 99% of the enrollees on Medicare Advantage plans required prior authorization. Skilled nursing facility stays, 98% of current Medicare Advantage enrollees this year required prior authorization. And guess what? Many were denied, unfortunately. Inpatient hospital stays, acute, 98%. Inpatient hospital stays, psychiatric, 94% required prior authorization. Diagnostic procedures, labs, and tests, 93% of Medicare Advantage enrollees required prior authorization for those. And so when I'm saying all the enrollees, that includes every Medicare Advantage plan this year. So this is a great study that is from Kaiser Family Foundation. Partial hospitalization, 92%. Home health services, 92%. Physical therapy and speech language pathology, 89%. Comprehensive dental services, 88%. Diabetic supplies and services, 85%. Opioid treatment services, 85%. Mental health specialty services, 85%. Psychiatric services, those are all important. All of these are important. 85%. Outpatient substance abuse services, 83%. Dialysis services needed less. People needed that, 66%. Hearing exams, 61%. Physician specialists. So to see your specialist, some cases you will need prior authorization. And by the way, in this category, if you're on an HMO, many times if you have a primary care physician, because you have to, if you're on an HMO Medicare Advantage plan, many times the doctor, the PCP, the primary care physician, won't give a referral out because they try to keep everything in-house. They get paid more for doing so. So please be aware of some of these things. That's why I have this channel, Medicare Secrets, to uncover some of these things. Eye exams, 57% needed prior authorization. Transportation services, 49%. Which to and from the doctor is one of those extra benefits they give you on Medicare Advantage plans. Preventative services just needed 6%. So I think it's a great study by the Kaiser Family Foundation. I'm just going to read this little article This little paragraph after, Medicare Advantage plans can require enrollees to receive prior authorization before a service will be covered. And nearly all Medicare Advantage enrollees, 99%, are in plans that require prior authorization for some services in 2022. Prior authorization is most often required for relatively expensive services such as Part B drugs, 99%, skilled nursing facility stays, 98%, and inpatient hospital stays, acute, 98%, psychiatric, 94%. And it is rarely required for preventative services, 6%. Majority of enrollees for some extra benefits in plans that offer these benefits, including comprehensive dental services, hearing and eye exams, and transportation. The number of enrollees in plans that require prior authorization for one or more services stayed the same from 2021 to 2022. In contrast to Medicare Advantage plans, traditional Medicare does not generally require prior authorization for services and does not require step therapy for Part B drugs. I'm going to read that again. Traditional, federal Medicare does not generally require prior authorization for services and does not require step therapy for Part B drugs. It really does dive into a lot of the issues that we have when it comes to the Medicare Advantage plan. My company writes both. It really just depends on your specific situation. Our original Medicare program, which started back in 1966, our Part A and Part B, is incredible as far as a healthcare system. You have to wait to get on it. You have to pay into the system. And then once you're turning 65 or you unfortunately would become disabled, you become eligible for Medicare. And that original Medicare program, that $170.10 that you pay for the outpatient side, the Part B, they look at your Medicare card like it's a gold card. And there's no questions asked. There's no prior authorization. So I'm not saying Medicare Advantage plans are awful, but I can tell you when it comes to my personal opinion, again, this is my personal YouTube channel, so I can share my personal opinion. Original Medicare is a better program because you don't have to jump through hoops to get your coverage, to get things approved. There's no prior authorization. So that's the big red flag with Medicare Advantage. When you're on original Medicare, that does not happen. Nothing needs prior authorization. If you have a medically necessary issue that your doctor has deemed it medically necessary, Medicare has to pay 80% of that bill. Any questions, please comment below. I love to see the comments. Subscribe to the channel. I appreciate it. There's a lot of information, breaking news coming out before this upcoming open enrollment that starts October 15th. Stay close to the channel. You all have a great day. And remember to subscribe to the channel and hit the like button if you like the video. It will help the algorithm so we can get the word out.